What we're going to do is we're going to do the arteries first. And remember, arteries are taking blood away from the heart. So what I did was take off the pericardium. And so what I'm going to do is slice through the heart so that you can see the chambers. So if we look at the outside actually first, see these little flappy things? There's one on this side, the right side, and then there's one all the way back in here. On the left side. Those are the atria, right and left atrium. And then I'm going to cut open the ventricles so that we can see the difference. So on this side with the blue, look how thin the wall is. That's the right ventricle. And then look how thick the wall is. We'll have some cardiomegaly there. Kitty cat. All right, so the right side ventricle walls are muscular, but they're not as muscular as the left side. Anybody have an idea why?
Pump the blood to the body.
Why is the left side of the left ventricle so much?
The left one goes through the aorta and pushes it to the rest of the body.
Right, so that's in charge of the systemic circulation, and then this one's in charge of the pulmonary circulation. So the right ventricle, from the right ventricle, we have blood being pumped to the lungs. So blood is pumped to the lungs through this giant vessel right here. See this vessel? That's the pulmonary artery. What kind of blood? Oxygenated or deoxygenated? Deoxygenated. So usually arteries carry oxygenated blood because they're carrying blood away from the heart. This is the one exception. It is carrying blood away from the heart, but it's deoxygenated blood. Okay, so it's taking it to the lungs to be oxygenated. So blood that's pumped from the left ventricle to the body goes through this big vessel here that kind of makes a curl around. So I'm gonna cut these lungs away on this side just so that we can appreciate this left, this systemic circulation a little bit better. So this big vessel is the aorta, and the aorta has an arch to it because it curves around, and then up until we hit the diaphragm here, this is the dorsal aorta, but it is the thoracic aorta. We call it the thoracic aorta because it's in the thoracic cavity. Once it hits the other side of the diaphragm right here, see it continues on all the way down here, it becomes the abdominal aorta. All right, so we have the thoracic aorta, and the arch of the aorta has two branches that we can visualize. There's one branch that we can't visualize because it's the first opening or ostium from the arch of the aorta, and it kind of occurs just as blood is exiting the left ventricle into the aorta. We can't really see it here, but on some of your cat's hearts, oh, I can see one. See this little pink line here that has branches? This is a coronary artery, and it's part of something we call the vasa vasorum. And the vasa vasorum is the group of blood vessels that's bringing oxygenated blood to the organ itself. So there's a vasa vasorum in the kidney, there's a vasa vasorum in the heart, and we call this the coronary artery. Okay, so we have the coronary artery, and then again, here's the arch of the aorta, and right here, see this right here, that's the pulmonary artery. If we look at the arch of the aorta and the pulmonary artery, we can see that there's this ligament, there's this connective area between the arch of the aorta and the pulmonary artery. That ligament is called the ligamentum arteriosus. It is the remnant of fetal circulation. During fetal circulation, blood is diverted away from the lungs because the baby does not need to oxygenate blood with its lungs. It gets all the oxygen from its mother. So one of those diversions is the ductus arteriosus, and it will shuttle blood from the pulmonary artery directly into the aorta so that blood is going throughout the body. After birth, the ductus arteriosus forms the ligamentum arteriosus, and we need to know what that is, okay? All All right, so our arch of the aorta here, though, has these two really good branches that we can see. The first branch is called the brachiocephalic trunk artery. Old school people call this the innominate artery. I would never tell you that because I think like there are maybe a few really old dudes that practice medicine that still call it the innominate artery. So what I'm going to do here is I'm going to show you the different branches of the brachiocephalic artery, brachiocephalic trunk artery, but what I need to do is to be able to see it is to cut this vessel right here, this blue vessel. What do you think this blue vessel is?
Superior vena cava?
Yep, or the precava. I call it the precava. And these two large branches that are branching into the precava, these are the vertebral veins. So remember, all of these blue veins are draining blood from the head and upper body region. So blood is coming from the head and going down into the right atrium. So let's actually do the upper veins first. I'm sorry for switching gears, but I want to be able to show you these before I cut them. So as we're draining the head, blood is coming from the front portion of the head and the back portion of the head through these two veins here. This is the anterior facial vein, and it joins in with the posterior facial vein here. And right about that area where the two join together, this vessel that's going across the neck here, that's right at the junction of the sternohyoid, is the transverse jugular vein. So this is, remember, this is that juncture where we found those sublingual salivary glands, right? So we have the anterior facial vein, the posterior facial vein, and the transverse jugular vein, and they are feeding into this big vein right here. This is the external jugular vein. And if I follow the external jugular vein, I can see that it enters the body right here, just about where the sternomastoid and also the clavotrapezius are. So I can watch this and follow it into the thoracic cavity here. Okay, so here's my external jugular coming in from outside, and the external jugular is joined by this vein here that usually isn't injected very well. I can't even find it on this side. I guess this is it right here, this little weeny thing. But this is the internal jugular vein, and it usually runs right alongside this pink vessel here, which is one of your carotid arteries, your left carotid artery. Okay, so you have your external jugular vein, internal jugular vein, and they're joining in with this vein coming from the arm, which is the subclavian vein. So here we have both right and left veins. The subclavian vein, the external jugular and the internal jugular, will dump into this big branch here that is the brachiocephalic vein. Okay. The brachiocephalic vein also is joined by this blue vein that's going out to the chest area here. Jesus Christ. And yes, and that's the internal mammary vein. Okay, so the internal mammary vein, subclavian, external jugular, internal jugular, all branch into the brachiocephalic vein. See, there's one on each side. And those dump into the precava. And we have two big branches here. It looks like this guy has three. Wow. Those are vertebral veins. So the vertebral veins join into the precava. And now there's a hidden vessel that also joins into the precava. And we can only find that on the right side of the thoracic cavity. So you see this blue vessel right here? It curls around over here, and just about before the precava dumps into the right atrium here, this vessel dumps into the precava. This is called the azygous vein. Azygous means without a twin. Azygous vein. Okay, so again, anterior and posterior facial veins join in with the transverse jugular vein, join in with the external jugular vein. External jugular vein enters the body cavity, joins with the internal jugular vein, the subclavian vein, to form the brachiocephalic vein. The internal mammary vein joins with the brachiocephalic vein. Both brachiocephalic veins flow into the precava, are joined by the vertebral veins and also the azygous vein, and then dump into the right atrium. Okay, so I'm going to cut the precava just below the vertebral veins so that we can see, and I'm going to cut this vertebral vein too, so that we can see, and this internal mammary vein, our first branch of the arch of the aorta. Okay, so again, this is the brachiocephalic trunk artery, and it runs along with the precava. Okay, so remember, when we're talking about arteries, we're going away from the heart. When we're talking about veins, we're going toward the heart. So our first branch off the arch of the aorta is the brachiocephalic vein. And you can see as we move up that there are 3 branches off the brachiocephalic artery, trunk artery. These first 2 branches, sometimes there's an area, like right here, where the 2 join together. This is called the carotid trunk artery, or common carotid trunk artery. And we have a right common carotid artery and a left common carotid artery. Okay.
Does it have a carotid body?
Up here, where it splits up into internal and external carotid arteries, which we're not going to do,
Okay.
there are carotid bodies.
Okay.
Okay? Let's see what we have there. All right. So now we have our carotid trunk and common carotid arteries. The branch that goes off to the right arm here, this is called the subclavian artery. Okay, the subclavian artery has several branches from it. Okay, you guys ready? The first branch always goes down or posterior. And it goes toward the chest cavity here. This is called the internal mammary artery. Internal mammary artery. And then there are 3 branches off the top side of the subclavian artery. This first branch here is the vertebral artery. The second branch here is the costocervical trunk artery. And then the final branch way over here is the thyrocervical trunk artery. Okay, so we have the brachiocephalic trunk artery, which splits off into the common, or the carotid trunk artery, and the right and left common carotid arteries. It also splits off into the right subclavian artery, which has branches including the internal mammary artery, the vertebral artery, the costocervical trunk artery, and the thyrocervical trunk artery. Now, the second branch off the arch of the aorta is the left subclavian artery. So the left subclavian has its own branch off the arch of the aorta. And we can subsequently find those same branches that we found in our right subclavian artery. So our first branch, internal mammary artery, and then we have the same arrangement, but they're kind of differently spaced. The first branch, the vertebral artery, the second branch right here, the costocervical trunk artery, and then the third branch, the thyrocervical trunk artery. Okay? Just a couple things. Now, if we follow the arch of the aorta down, we see that it becomes the thoracic aorta, And if we kind of pick away at the mesentery here, we see that there are several tiny little tributaries coming from the thoracic aorta going off into the ribs. These are called the intercostal arteries. We can find intercostal veins going into our little azygous vein here. Here's one of them right here. So intercostal veins going into the azygous vein. Intercostal arteries coming off the thoracic aorta. Okay, so if we follow our thoracic aorta into the abdominal cavity, it becomes the abdominal aorta. And the abdominal aorta has several branches on it, or from it, that are feeding the various digestive organs. So our very first branch is this one right here. Okay, this branch is called the celiac trunk artery. Celiac spelled C-O-E, celiac trunk. And the celiac trunk artery has 3 main divisions or branches coming off of it. There's one right here, and then there are 2 that are going to the same place, right here. This first branch is called the hepatic artery, and if you follow it, it will go to the liver. The second branch, okay, get this, the left gastric artery. There is no right gastric artery. There is just a left gastric artery, okay? Right? No, left. All right. So, and then finally, we have these 2 divisions here at the end that are going up to the spleen, splenic arteries. Okay? So our first branch in the abdominal aorta, off the abdominal aorta, is the celiac trunk. It has a hepatic artery, a left gastric artery, and splenic arteries. Now the second branch is right after the celiac trunk, and it is this branch right here that's going to the small intestine area. So if we follow it through here, it goes all the way over to the pancreas ocelli, and all of these little divisions go to the small intestine, the jejunum area. This branch is called the superior mesenteric artery. Superior mesenteric. Now, as we go down further on this abdominal aorta, we see that there's another teeny tiny branch here going to this fatty area at the apex of the kidney. What's there? You guys remember? Adrenal gland, yes. So this is the adrenolumbar artery. And look, there's a blue vein accompanying it, coming from there into the post cava. That's the adrenolumbar vein. So you can usually find a lot of these paired together. So adrenolumbar artery. And then we have this huge artery going over to this left kidney. What's this one? Renal artery. Look, there's a renal vein, same area. Okay, let's follow this. Here's our abdominal aorta. Follow it down here, and I see one little thin artery coming off this way and going down here through the inguinal canal and out to the balls. This is the testicular artery, so it's right here. Now these are paired. There's one on each side. Our unpaired arteries, however, are the celiac trunk, the, what's that called? Superior mesenteric. And then this one right here that's going to the colon, inferior mesenteric. Okay. And then as we get to the posterior region, you see this branch that one goes that way, one goes that way. See these pinks? There's one right here and one right here. These are the iliolumbar arteries. So we have adrenolumbar artery, renal artery, testicular artery, inferior mesenteric artery, iliolumbar arteries. And then if we look down here, going to turn this around so you guys on this side can see it a little better. But our arteries start splitting off like the branches of a tree. So they're like the letter Y, I guess. So they're like this.
Iliac?
Yes. So we have the anterior ones are the external iliacs. The more posterior ones are the internal iliacs. And then one goes straight back to the tail, and that's the caudal artery. So you can see it a little better. See? External iliac, internal iliac, and caudal. Okay?
Now, in the female, instead of the testicular arteries?
It would be ovarian.
Okay.
Okay, so let's work on the veins and work toward the heart. Okay, so